Okay.
All right, we are live. We're just gonna wait for a few minutes for people to join, for a few seconds for people to join. Awesome, awesome, awesome. We are live. So if you oh, hold on one second. All right. Okay, so if you just want to tell us a little bit about yourself while we are waiting for people to join, please.
Okay, my name is Ifani Odua. I'm a family nurse practitioner. I've been a nurse practitioner for I don't even know how many years. How many years have I been a nurse practitioner? Maybe 7 or 8 years now.
Wow.
Most of my experiences in primary care and urgent care. Lots of pre-ops for people getting surgeries, especially the one that we're going to be talking about today.
Awesome. Awesome. Okay, so whenever are you ready, we can start sharing the screen.
Okay.
All right. So tell us about what you're going to be talking about today.
We're talking about the trending surgery. Brazilian butt lifts. Almost everyone is either thinking about getting one done or knows someone that recently got one done or wants to get one done. Um, it's a very popular cosmetic surgery, probably the most popular cosmetic surgery going on in the US right now.
Okay. All right. So I'm ready for you whenever you are. I'll advance the screen whenever you want me to.
Okay, all
All
right,
right.
we'll go to the next slide. All right, so today we're just going to talk about the basics about Brazilian butt lifts, aka BBL, the benefits of getting them done, the risks associated with them, and whether or not you or the person that you know should get them done.
All right.
Go to the next slide. All right, this is the typical example, or let me say, desired results people want from BBLs, going from a small peach to a big peach bottom. And for most people, they get, good results, but pretty much that's like summary is small butts to big butts. All right, you can go on to the next slide. All right, what is BBL, Brazilian butt lift? A Brazilian butt lift is a special surgery where they take the fat, um, excess fat from your hips, from your tummy, from your back, with lipo from your thighs, and insert it into the butt to give it the shape that you desire. Um, it is a surgical procedure, mostly done under general anesthesia, and has to be done by a plastic surgeon, a certified plastic surgeon, and can cost anywhere from 3,500 to 1,500. Not 1,500, sorry, 15,000 US dollars.
So
Not
from 3,500,
yes to
there's
50.
a Brazilian butt lift for 3,500.
Yes, when I did my
Oh,
research,
yeah.
all you need to do is go on Instagram. There's so many surgeons out there doing specials. It's crazy, it's ridiculous, but you can actually get a BBL done for 3,500. Now, what you're gonna look like when it's done is questionable, but it's possible.
I think I'll be scared to do the one for 3,500.
Yes,
Okay.
but some places in the US actually, especially in Florida,
Wow.
we have lots of discount surgeries. It's like almost buying. It's like buying something over the counter now.
Oh my goodness.
Yeah.
Oh wow.
All right. So, why do you need to get a BBL done? Why do some people want to get it done? Oh no, not why, but what do you need to get one done? Okay. First of all, you have to have good skin tone. You know, some people desire the surgery, but if you already have excess skin hanging, you might not be a good candidate just for BBL. And if you don't have enough fat stores, if you're really slim person with limited amounts of fat reserves, fat around your waist, your belly, your arm, there's nowhere they're going to get that fat from to put it in the buttock. So you hear about some people that are slim trying to put on weight several months before their surgery just so they can have enough fat to pull out and put in the butt. So you need good skin tone, meaning no hanging skin around the areas that you're going to be getting the fat from, and enough fat stores around your body to put in the butt. You also have to have time on your
Hmm.
hands. If you're a busy person working really hard, don't have vacation time, or you have children that you have to run after, carry, it's probably not good time for you. Probably not a good candidate to get it done because you're not going to be able to sit down for 2 whole weeks. You cannot sit on that new butt for
Mm.
2 weeks. You have to be standing or laying on your tummy. Um,
Mm.
because if you're sitting on the new butts, you risk developing problems with the butt, the shape of the butt. You can develop fluid buildup, blood buildup, scarring, things that are not desired. So you have to have enough time where you don't you can lay down on your belly for 2 weeks or stand. And then the total recovery time is about 6 weeks. So
Mm.
even though you can sit, you might still be very sore for several other weeks. Um, so if you have good skin tone, you have enough fat where you can get the from your body to put into your butt, and if you have time on your hands, then yes, you are a candidate for BBL surgery.
Mm. Mm.
All
Only
right.
your butt, no sitting. So if
No,
you're not sitting, you can change the shape of the butt.
yes,
If you
because you're
sit.
gonna be sitting on, you need that butt to be nice and plump and bubble like, and if you're sitting on it, you're going to be moving that fat in as opposed to letting it settle out. Plus, you're going to be sore.
Mm.
So, you have to stay away from sitting on the butt for 2 whole weeks. So,
Wow.
I
Wow.
know something to consider before getting the surgery done. All right. So, next is why do people want to do this surgery? One, to get the nice curves. We're all watching TV and seeing all these celebrities out there with very nice body shape, which they pay for, and we want to have it too. So you want to have those nice curves. Um, some people more for like self-esteem. Maybe they're uncomfortable with the way the belly is hanging out, or the butt looks flat, or the thighs are not thick enough. So to get that appealing look that they see on TV. Let me say they. Let me say we. Lots of people. I'm a woman too. Sometimes I think about it. If I can get my little baby pouch gone and put it in the butt for clothes to fit properly. Some people, have a wider abdomen and very slim hip and butt area. And then you buy the pants from the store, and then you don't like the way it looks because it's not hugging you in the right places. And some people are getting older and they want to stay young and they hit certain age and they feel like, you know what, I used to look sexy back in the day. So now you want to go back so many years to your youthful appearance, and then and then you have people that actually, I don't know what they need, but they're actually people that may need some reconstruction after certain life events. I don't know, accidents, some things that give them some deformity um, of their body, and maybe a BBL can help restore some of the shape prior to the incident. But basically, why get a BBL done is to look good. That's the bottom line. If you want to look good in your own eyes, because looking good is a very broad term. What looks good to some people is awful for others. So some people want to look good in their own um, eyes or their partner's eyes. Certain partners are actually the ones that are paying for their female partners to get these surgeries done because they want a bigger butt. Not personally, but some people's partners actually want them to have a big butt and they pay for the surgery. So yeah, that's why most people get it done. You can go to the next slide. All right, these are some examples of the results we can get from BBLs. You have the first one that's like fresh from surgery,
Wow.
nice and glowing, and you can see the big difference, from the pre-picture to the post-picture. Most of these things are done within a couple hours, 3 hours sometimes, and that's all it takes. It's not a very long procedure to have the results. And then you have some that don't look as good as we would have hoped. But you have some that end up
Horror.
being ridiculous. Some people look like, they need to be deflated.
I'm not sure who this person's surgeon was.
3,500 in Miami.
Probably. Oh
um,
my goodness.
yeah, so we have nice ones, and we do have sometimes where the outcome is not as expected. So there's always variations in the result. There's not one set results. Something people discuss with the surgeons. You want a big one that looks more natural, or one that looks really huge. It's all personal decisions. But just some pictures to show you what some of the results look like, ranging from good to not so good. Okay, next slide. Okay, risks of getting this surgery done. It looks good and the benefits are great: instant flat tummy and instant big butt. However, we have some risks that you need to be aware of before you consider the surgery. After I did some research, I found that the Brazilian butt lift is actually the deadliest plastic surgery there
Wow.
is. So not the deadliest surgery, but the deadliest plastic surgery there is. So it's something to definitely think about. About 2 in 6,000 people in the U.S. This was a research done in 2017 or 2018. In the U.S. found like 2 people out of 6,000 die actually from complications of having this surgery done. It doesn't sound like a lot, but if you look at it on a bigger scale, it's actually a lot of people that are dying from this surgery. But that's rare. It's not common. It's not a common thing to happen and people die, but it's a possibility and it's a high risk. Um, but the more common, more mild risks of getting it is scarring around the area. So you might have these scars from areas where they pull the fat from and where they insert the fat through might not be appealing, especially if you have skin type that is prone to scarring. So you have people that have keloids, where the skin heals with extra skin on top of it, so doesn't look good after the surgery with scars everywhere. Some people have loss of sensation in the areas that are worked on. So there might be numbness in those areas of the skin. A seroma can also happen. That's buildup of fluid under the skin. That's usually short term, and drains can be put in the areas where there's fluid buildup to get some of that fluid out of the skin.
Mhm.
Asymmetry is also something that can happen. So, accidentally, more fat can be put in one butt than the other, so the butts don't look even. Um, or, even with the asymmetry, not all the fat that is put in is absorbed the same way. So some butts may absorb more fat than the other. So the left butt might have more fat than the right butt. At the end of the day, it won't look symmetrical. And fat reabsorption. So that's something that can happen, is where they put in all the fats and it looks good short term, but then the body reabsorbs some of the fat. So maybe the butt goes back smaller than how it looked initially because your body is absorbing some of the fat
Oh,
back,
wow.
yeah, into the system. So that's something that can happen. Those are like the common things. Most complaints that people have are those ones that we just talked about. And most of them are easily fixable. People go for repairs.
Oh my God.
If the fat is
I'm just I'm just thinking about it. Sorry. Just like after doing the surgery and then you have to go back to now
not back,
repair.
yeah, because the look, after the procedure may not be what you discussed with the surgeon prior to. It might
What I ordered versus what I got.
exactly what you order versus what you got. It might be too big, too small, not symmetrical, things like that. You might have scarring, and now you have to go have the scar repaired with, skin surgery. So it's just common things that you can expect to happen with those. Now, the more serious and the more rare ones we can talk about now. One of them is infection at the incision site. So if proper technique is not used, you can develop infection at the surgical incision sites. Sometimes everything has to be taken out. You have to have a procedure where they debride and wash you out. So end up losing the butts to begin with. Bleeding can happen. If you have some kind of bleeding disorder that is not picked up during your pre-op testing, that's something that can happen, is excessive bleeding, or if um, an artery or is accidentally severed while shoving the fat in. Some people can bleed out or bleed internally. You have people that get tissue necrosis. Tissue necrosis is where the tissue actually dies. So during the procedure, they might sort of like cut circulation to some of the areas where the fat is being introduced, and the tissue dies. When the tissue dies, it goes black and it can spread out, so it needs to be washed out. That happens mostly with smokers. If you're a smoker, you're more likely to have issues with blood circulation, vascular issues, so you won't get enough blood supply, and then you're likely to have tissue of your skin dying. All right, looks like someone had a question.
Says, do you have to revisit with BBLs too?
Revisits. Can you clarify what revisits
I'm
mean?
I'm not sure if means like redoing it or like having visits again. If you can clarify what you mean by revisits. Okay.
Okay, so I'll wait for your clarification, and then we can answer your question. Okay, another thing, which is like usually the cause of the death in the people that have died. They did some research to, like on they did some autopsies on some of the people that died after the BBL surgeries, and found that the cause of the death was from fat embolism.
Hmm.
So, fat embolism, some of the fat that is being shoved in, if proper technique or even just by accident, some of that fat gets through a vessel. It can travel just like a blood clot, but this would now be kind of like to make it late term, a fat clot. And it travels and it can travel to the lungs and cause a pulmonary embolism. It can travel to the heart and cause like a heart attack. All right, during follow up years after surgery. So no, usually there's follow up scheduled with the surgeon within weeks of the surgery. Some of them have you come back in a week or 2 weeks to make sure that you're healing properly. Sometimes after 6 weeks, and then the rest of it is pretty much up to you.
You're on your own.
You're, but it's usually the initial phase of just making sure that you're healing properly and you're not having those post surgical problems like infection at the incision sites. After that, pretty much done. The final results for BBLs usually within 6 months. So it takes 6 months for all the fats to really settle, and all the fat that's going to be reabsorbed usually will get reabsorbed around that time. The bruising, the scarring start to like disappear. Like you get that perfect, I'm done with my BBL surgery look usually within 6 months. And after that, the butt is yours for years to come. Now, how long that butt lasts, it really depends on what you're doing. Like if you're losing weight rapidly, the butt can start to look a little awful. If you are gaining weight rapidly, also like so, it's even though it was surgically done, you also kind of have to maintain your own lifestyle to keep the butt looking good. So you don't necessarily have to follow up, but like years after. But if you're not sort of maintaining your own physique, the butt can become an issue for you again down the line. I hope I answered the question um, about the follow ups. All right, the decision about the BBLs. What is the recommendation? Should you get it or should you not? BBLs are very popular now. I'm Nigerian, and something that I feel like back in the day would have been like, oh my goodness, this person did plastic surgery and they have it, but it's actually more, accepted, more popular. Um, so many of our Nollywood actresses are getting it done. So many celebrities here are getting it done. So it's very popular. You probably know someone that's gotten it done, and you're probably thinking about getting it done too. But the decision is not something that is a medical decision, or I don't know. I don't want to bring religion into it, but it's ultimately a personal decision. It's something that you have to think about if you have the necessary requirements, including the time to do it. Do you have time to recover? And is it worth it for you to go through the risks, potential death, scarring? Is it worth it to have that really nice butt? Maybe it is. Maybe you're suffering with like your self esteem, and that's the thing that you need that's going to boost your self esteem and get you out of that depression. So it's not something that I can say I recommend or don't recommend. It's really something that should be personal. Think about it, think about the risks associated with it, think about the benefits of having a nice peachy butt, especially in those nice clothes. And you make your decision if it's right for you. Do you really need to change your appearance? Do you really need to have surgery? Is it affecting your relationship with your loved ones? um, so it's ultimately a personal decision, that you just think about the risks, think about the benefits, and you know make the decision for yourself. um the bottom line is you have to find, if you do want to get it done, you have to find a good surgeon. There are so many surgeons out there in Florida, especially, for good prices, that are offering this surgery. but we have surgeons that are actually certified by the Board of Plastic Surgery. It's better you get one of those surgeons to do them for better outcomes. Because it's so popular, we have people that are not certified actually giving these procedures out there for people that need it. I know so many people that have traveled. I've had so many patients doing follow-ups with me after they've traveled out of the country or out of state to get them done, and they have really poor results, or they have concerns about the way they're healing, or they have infection. So bottom line is, do your research, find someone that is board certified, find out how many surgeries this person has done, if they're just starting up their practice versus if they've done, thousands of these procedures. That will affect your outcome. um, by law, surgeries are not supposed to be like several of them scheduled in a day, but because of how much turnaround and how much money some of the surgeons are getting, you have surgeons that are doing 4 or 5 of these a day. You have to make sure, I would say, you're the first patient that's scheduled, so that time and fatigue is not something that would be affecting your surgery and your outcome. So, do your research, find a good surgeon. If you're thinking about this surgery, make sure they've done enough um, surgeries and make sure they're board certified. If you know someone that has had one done and you like their results, it's better to go with someone that, versus someone that's offering you 3,500 online on Instagram,
Mm,
and you end up looking like one of
don't
these.
do it.
Don't do it. If you're getting it done, make it a good investment, save up some money, that way you get it done properly. And that is what I have to say about BBL. It's just basic. I didn't want to go too deep with lots of surgical terms, but just basic information. I don't know if that was
So
helpful.
let me ask you a question. What do you do when people travel out of state or out of country? When they traveled out of state or country to do the surgery and then come see you and say, "Oh, I have questions. It's not healing right. I don't know what's going on." Like, what do you say to them?
I ask if they're able to, by phone, televisit, contact the surgeon, of which most of them have. And those surgeons are not doing tele visits to follow up
Hmm.
with their patients. And I just help. If there's an infection, we can treat the infection at the site. And I let them know, like, you're likely going to end up with this scar, and there's not much we can do about it. Other than possibly revisiting it in the future, having a repair of the scar done. But it's basically treating whatever we see. Some people are not happy with their outcomes. Well, that's the outcome. We can only treat infection, like just in the medical world, we are worried about the more um things that have more risk. So do you have infection, we treat it, and that's it. If there's signs of fluid buildup, we send you maybe to a general surgeon to get drains placed. Other than it, there's not much that can be done. So really think carefully before going out of town from your primary care to get the surgery done.
Can people reverse it? Let's say someone got the surgery and then maybe a year down or 2 years down the line, they're like, I don't think I like the butt anymore. I don't, it's too big or some. Can they like go back and reverse the surgery?
Yes. So people, you can have lipo, since it's fat that
Mm.
was put in there. You can have liposuction, and they can suck the fats out again. So if
Wow.
there was any fats taken out from other places, it's possible, but it's not really common that people would want fats put back in their abdomen or their thigh or their arm.
Yeah.
But the fat can be, it can be sucked out from the butt if it's too big.
Okay, so I guess the bottom line is do your research before you go to the surgery. And my key points from what I got today is you cannot sit
For two.
for 2 weeks. Like, I cannot imagine not being able to sit on your butt for 2 weeks. Like
Yeah.
this is what people go through to get this surgery. You
Yes,
cannot sit on your
you
butt
cannot
because
sit
it
on
can
your
change
butt. Yeah.
the
Now
shape
the
of
surgeons do provide like a little, like I think it's like a
the
donut
pillow, donuts.
where you can sort of like kind of sit, but it's not really like sitting on the butt. I think it like has a ring where your butt can sort of,
Feeling
yeah,
to like preserve the shape.
the shape of the butts. Yeah, but you can't just like go sit down on a regular chair. No. For 2 weeks. So if you have time on your hands, and you're not worried about other people that like some of us are carrying children and you have to sit down with them and stuff like that, not a good time. But maybe down the line.
Okay.
Yeah. The one that got me was the death. I was like, sometimes I think about things like that. Like I feel like, we're all human. Sometimes we're like, man, if I can get rid of this pouch. But then I'm like, do I really want to?
But that's um tummy talk though. That's not BBL.
For what?
To like the pouch on your, like you're talking about like the pouch on your tummy,
Yeah,
like you
like,
don't want to
suck the
remove it.
fat out of there to put it in, and then put it in the butt.
But what if you don't want to do the butt and you're just getting rid of the pouch?
Well, that's different. That's a tummy tuck. That's
That's
a
a
completely
different.
different procedure, yes. Well, people
Okay.
have, it's almost like a la carte now. I want a tummy tuck and a
Baby.
BBL and a breast reduction. It's a la
Mm.
carte. You can tell them all the things that you need. And they give you the pricing and you can get them all done.
Packaging.
Yeah, you can get a package. Mommy makeovers. There's so many of them.
Oh wow. Yeah, yeah, yeah. I've heard of that. The mommy makeover where they lift your breasts and
Hmm.
then they do the liposuction on your tummy or tummy tuck and then they do the BBL. So it's like
It's a
back
package. You're
back
transforming, snatching you back to your
back
pre
back
mommy.
to where I was before. I started having popping these kids.
Yes,
Sounds good, but it's a little bit scary.
it's all scary. The outcomes when you see people. Some of them look really good, and you feel like I need to get this done. Think about your risks, your health. If you have certain health conditions, and um,
You know, one thing that I'm actually glad about is that at least this is coming out to the light,
mhm,
because before celebrities would have their kids and in like 6 weeks or few months down the line they're like they like back to their, and people did not understand why.
like
It's
what
like it was only celebrities that would just bounce back to their bodies, and people were like wondering, how can I do this? Oh, working out and doing all these things, and they're not getting the results, not knowing that they're getting these surgeries done. It was like a thing where it was only for celebrities. So I'm actually glad that is coming out to the light now, that people can
yeah,
actually, because sometimes people have flat tummy and you're like, I've known this person with a big tummy, like, what happened? And they would tell you, oh, I've been working out, not knowing that they went and got these surgeries done, and they're wearing these waist trainers and you're thinking it's a waist trainer, but it's not. And I feel like that's just not right. You have your body, you can do whatever you want with your body. Nobody's going to tell you how to treat your body. So if you want to get the surgery, get the surgery. But I don't think it's okay for you to lie to people that
yeah.
worked out to get
Waist
your
trainer.
body.
You got this really good waist trainer.
Yes.
And then you start
Oh, buying
selling
the
the
waist
waist trainer.
trainer.
You're selling water bottles, and you're telling people to drink. What do they call those things? You're juicing
See,
and
yeah.
smoothies.
When you know very well that you went and did something, that's not okay. If you're gonna do it, then own up to it, do it. But if you don't want to share it too, oh, that's okay, that's your personal thing. You don't have to share it, but I don't think it's okay to do it and then tell
Tell
people,
people that you're
oh yeah, I've been working out, and then people will start working out, killing themselves in the gym, and they're not having the same results. Like, God, why did you do this to me?
working. I
So
know.
Yeah, I'm actually glad that this has come out to the light and people are aware and is available. If you want it, that's on you. If you want to do it again, you want to do your research and make sure that it's your thing. Like personally, I think sometimes about getting a tummy tuck, and people will be like, Indy, you don't have a tummy, you don't have to worry about it. I'm like this, there's this little pouch that I just want to get rid of. Like, how can I get rid of this pouch here?
Okay, let me sell you my waist trainer.
Let's see. Does waist trainer work?
No, I will stand on any platform to tell you that it does not.
You're just squeezing the life out of you.
Yep, you're squeezing it. It does not get rid of fat. There is no science behind that. There's temporarily you can squeeze it and you
Shrink
put
it.
it on
Yeah.
and it looks good, but once you take it off, it's gonna hang out.
Mm. So how do we get rid of the pouch?
You can exercise.
uh,
You can exercise. It takes a long time, but it's doable.
what if the like people that their muscles are already weak, like abdominal muscles are weak to pull everything back in and get rid of it. You just want to cut it off.
Okay, cut it off.
Oh my goodness. All right, guys. So that's all we have today. Ify, do you have any final words? Final thing. Where can we find you? Ify, where can we
I'm
find you?
untraceable. I'm here. I'm here. You can drop my email maybe on your link, ify80 at icloud.com. You can email me if you had any questions, personal questions, want more information um, about BBLs.
You just opened a new clinic with your husband. What is it called and where can people find it? It's a mental health.
Yes. So my husband is like the provider for this, but it's a mental and behavioral health clinic. It's called Breakthrough Behavioral Health Services, and it's for mental health care. You can find us on Instagram or on the website. It's www.breakthroughbhs.com. And you'll find information on how to reach and schedule appointments to discuss mental health on there.
What is it again? www dot what? Breakthrough
Breakthrough BHS.
breakthrough
BHS.com.
bhs.com.
Yep.
Right. So if you have any, like you have it, I have to say, if his husband is also a very solid Christian, so a man of God. So if you want someone that is going to be both, if you're a Christian and you want someone that is going to be able to take care, if it's your child, your brother, your sister, or someone that is going to be able to see you as the whole, both in a Christian and mentally, and just tie everything out together, you need to check it out.
Yeah, check
Check
it
it
out. Come
out,
see him.
and you will not be
Take care of you.
disappointed.
Thank
Yeah.
you, Lindy.
What is your Instagram handle again?
It is breakthrough underscore BHS.
Breakthrough
Make sure.
underscore BHS on Instagram. So you guys go follow them.
Yes.
All right. Thank you so much, Ify. I am
Thank
very,
you for
very
having me.
grateful. That was that
Pleasure.
was fun.
My pleasure. My pleasure. And thank you guys for tuning in. I hope you were able to get some info about BBLs. You've probably been thinking about it. I hope it was helpful.
All right. Thank you guys. Until next time, join us on June 11th at 11 a.m. We are going to be talking about STIs, PrEPs, sexually transmitted infections, and PrEPs and PEP. PrEP is pre exposure prophylaxis, and PEP is post exposure prophylaxis to prevent someone from having HIV. So join us June 11th. I believe it's at 11 a.m. So we will see you then. Until then, and it's gonna be Raven. So until next time, thank you so much for joining. Bye.
All right.
Bye, Ify.
All right. Bye.
Let's do some music before we go. So,